everyone. You're watching Eagle News America. I'm Thomas Likeness, broadcasting from our studio in Edmonton, Canada. It's Monday, March 22nd, 2021 on this side of the world, and a good Tuesday morning to our viewers in the Philippines. In the news tonight, we have updates from several of our correspondents from across North America. Ashley Sakmar in Toronto, Canada, will tell us about an anti-Asian racism report. Arlene Ocampo in Port Washington, Maryland.
Vaccine eligibility timeline for Marylanders is made available.
Mayanne Manzano Garzon in Sicklerville, New Jersey.
New Jersey Department of Health to allow in-person visits for long-term care residents.
Jane Kathleen Gregorio in Corpus Christi, Texas.
Texas congressman releases photos revealing condition inside holding facility in Donna. And the Texas governor directs the Commission of Environmental Quality to ensure safe conditions for a fourth migrant holding facility.
We'll also hear from Eliza Gonzalez Manglicmod in Washington, D.C.
The District of Columbia awards $2.9 million in grants to community organizations offering youth summer programs.
And Julianne Simbulan in Lancaster, California will also join us.
Free donuts. Vaccinated individuals get a sweet treat.
And our roundtable tonight is World Water Day. Our correspondents will weigh in on the need to conserve water. Our coverage begins now. For the second time in a week, there's been a shooting rampage in the United States. This one in Boulder, Colorado. Boulder Police Commander Kerry Yamaguchi says multiple people were killed. Today's violence began early this afternoon at a supermarket in Boulder. One of the victims is a police officer. Yamaguchi did not say how many others were killed, but some media are reporting up to 6 people died in that shooting. Police aren't confirming that number. Yamaguchi says forensic specialists are processing the crime scene. One man has been taken into custody. More details will be released in coming hours. Grotesque. That's the word the head of the World Health Organization uses to describe the growing problem of vaccine inequality. Dr. Tedros Adhanom Ghebreyesus blasted rich countries for hoarding vaccines. Tedros says the growing gap between the number of COVID vaccines administered in rich and poor countries is a moral outrage.
The gap between the number of vaccines administered in rich countries and the number of vaccines administered through COVAX is growing every single day and becoming more grotesque every day.
Tedros adds that wealthy nations are losing credibility. He says they talk about helping others, but their actions indicate otherwise.
The world's poorest countries wonder whether rich countries really mean what they say when they talk about solidarity. The inequitable distribution of vaccines is not just a moral outrage. It's also economically and epidemiologically self-defeating.
Scolded wealthy nations that are now vaccinating healthy young people at low risk of developing COVID-19. He says they're doing so at the cost of lives of vulnerable people in low-income countries. Tedros adds that rich countries might be buying some short-term comfort, but he says they're giving themselves a false sense of security. Tedros says as long as the virus is circulating in the world, people will continue to die and trade and travel will be disrupted. Let's look at the COVID-19 numbers now provided by the Coronavirus Resource Institute of Johns Hopkins University in Medicine. As of 6 o'clock Eastern Time today, the number of cases of COVID-19 reported worldwide, now more than 123,531,000. Top 3 on the list of countries with recorded cases: the United States with more than 29.8 million, India more than 11.9 million, Brazil more than 11.6 million. And sadly, the virus has claimed more than 2 million 719,000 lives. Top three countries with the most number of COVID-19 related deaths: the United States, more than 542,000, Brazil, more than 294,000, and Mexico, more than 198,000. Well, here's the latest on the AstraZeneca vaccine. Phase 3 trials in the United States show the vaccine is 80% effective in preventing COVID in the elderly. Also, the biotech firm says there's no increased risk of blood clots. Other findings in these trials: AstraZeneca was 79% effective at preventing symptomatic COVID-19 in the overall population. That's all age groups. And it was found to be 100% effective at preventing severe disease and hospitalization. Now, you recall that several countries had advised against administering the jab to older people. That was due to a lack of data among elderly participants in previous trials. Others paused the use of AstraZeneca over fears that it may cause blood clots. Maybe these findings that we hear about today will put those fears to rest. AstraZeneca says it will submit its latest findings to the U.S. Food and Drug Administration in hopes of getting the inoculant approved for emergency use. Well, a few minutes ago, we talked about vaccine inequity. Here's another one: water. In our part of the world, we take it for granted. We get it out of a tap or buy it in bottles. But in Nigeria, 1 out of 3 children doesn't have access to enough water. That data comes from UNICEF. About 100,000 children die every year of water-related diseases in Nigeria. Mustafa Emmanuel Yusadari is a water expert, and he says the government should be providing water as a basic necessity.
We really talk about potable drinking water is good. The government should provide at least potable drinking water, most especially for the children, the kids. They need potable drinking water. Before going to school, they need to drink water. Before doing their day-to-day activities.
Some of the effects of the water crisis: well, when wells dry up, children are the ones missing school to fetch water. When droughts diminish food supplies, children suffer from malnutrition and stunting. When floods hit, children fall ill from waterborne illnesses. And when water is not available in Nigerian communities, children cannot wash their hands to fight off diseases. The water crisis knows no boundaries. It is worldwide, and globally, 1 out of 5 children doesn't have access to an adequate water supply. We'll be talking about water at the end of the program. Stay tuned for our correspondent's thoughts on the issue. A couple of stories now from the environmental file. It was a year ago that fire threatened people's homes in Australia. Now it is water. Torrential rains in southeastern Australia have forced 18,000 people from their homes and shuttered hundreds of schools. 38 regions have been declared disaster areas. The days-long deluge has inundated coastal areas of New South Wales, including parts of Sydney. Now, New South Wales is the country's most populous state. 8 million residents have been told to avoid unnecessary travel, basically stay home, work from home if possible. Jane Goldring of Australia's Bureau of Meteorology says the region has been drenched.
Some locations have seen close to a metre of rain. Many locations have seen more than half a metre of rain. And unfortunately, that rain is continuing to fall in these same areas. This is due to a coastal trough, the combination of a slow-moving coastal trough and the approach of another system coming through from the west. And what that's doing is it's pumping down some tropical moisture into New South Wales, and that and the easterly winds is really what is generating this rain.
Health officials say the rain and floods will delay the already halting rollout of COVID vaccines in Sydney and surrounding areas. It's called the land of ice and fire. I'm referring to the country of Iceland in the North Atlantic Ocean. It's near the Arctic Circle. And nature has put on a show for people in this tiny island. You know, it has 32 active volcano systems. The latest eruption happened on the weekend near the country's capital of Reykjavik. It's the first time in 900 years that this mountain has blown its top. Experts say there's no danger to people, even though it's only a few kilometers from the city and the country's airport. No one is living near the actual volcano. Now, when it first erupted Friday night, it lit up the sky with a crimson glow, and it has proved fascinating for locals who came out to see rivers of red lava flow out of the mountain.
There were about 1,000 people here last night, so I was kind of expecting it, but it's still very, very many. It smells pretty bad, but for me, what was surprising was the colors of the orange were much, much deeper than what you'd expect. So, yeah, it's absolutely breathtaking.
We are just here to look at the people and see that everything is okay, and just watch out that the people don't go too close to the lava, and just asking people to step away back and just see that everything is okay.
Scientists expect the eruption will last for another couple of days. Up next, we have stories from Toronto, Canada, Maryland, and New Jersey. Eagle News America continues.
Kumanta, sumaya tayong lahat. Saya-saya.
Factual.
We have to defeat the virus everywhere.
Timely information. Balanced, not only in the country, but also abroad.
I'm certain of one thing.
Interviews that people need to know. Watch Agila Pilipinas, a 1-hour newscast of reports coming from regional hubs in Luzon, Visayas, and Mindanao. Know the important updates in Asia in ASEAN in Focus. Track the latest stories in the provinces in Agila Provincia. Tune into Mata ng Agila, the evening primetime news program of Net25. Balanced and objective, Mata ng Agila covers national and international issues, tackles news on business, health, science and technology, entertainment, sports and human interest features, and current events. And Eagle News International delivers the latest global reports, impartial, accessible, and up-to-date. It brings to fore EBC's rich international scope and access to valuable information streams.
Well, thank you to explain our health outdoor attack.
Catch these programs on Net25. You can also watch our news programs through eaglenews.ph and Eagle News Facebook page and YouTube channel.
Who will take home the glory? We'll find out as we head onto the Studies in Galing Part 2 Destination.
Impormasyong mahalaga sa taong bayan. Patas na pagbabalita. Papakinggan ang magkabilang panig. Lilinawin ang mga issue at kaagad na ihahatid ng objektibo. Mata ng Agila. Dumadagit ng pinakasariwang pangyayari, hindi lamang sa loob ng bansa, kundi sa iba't ibang panig ng daigdig. Mula sa Eagle News teams at sa tulong ng makabagong teknolohiya, tiyak na makakalap kaagad ang katotohanan. Para sa mas matalas, malinaw at malalimang pagbabalita. Ito ang mas pinatalas na Mata ng Agila. Inihahatid ng veteranong broadcast journalist na si Eli Saludar. Kasama si Binibining Pilipinas Intercontinental 2019, Emma Tiglao. At pinangungunahan ng batikang mamamahayag ng bansa Vic De Leon Lima. Mata ng Agila, Lunes hanggang Biyernes, alas 6 hanggang alas 8 ng gabi. Dito sa Net 25.
You're watching Eagle News America. I'm Thomas I. Likeness. This is a disturbing report. A study suggests that the number of anti-Asian racism incidents reported in Canada is actually higher than the United States when measured on an Asian per capita basis. We have more on that story from Eagle News correspondent Ashley Sakmar.
Amidst the COVID-19 pandemic, the rise in anti-Asian racism and violence has increased rapidly. Just this week on Tuesday, March 16th in Atlanta, United States, a white gunman murdered 8 people, 6 of whom were Asian women. Here in Canada, many Asian Canadians are outraged and are shedding light on the pre-existing anti-Asian racism ingrained within Canadian society. In May 2020, Statistics Canada released a report to show how the COVID-19 pandemic has affected visible minorities' perceptions of safety within the country. The report shows visible minority participants that perceived race-based attacks and harassment was 3 times larger than the rest of the population. The increase was most obvious within Asian participants, 30% Chinese, 20% Korean, and 19% Southeast Asian. The National Collaboration of Data Collection on Anti-Asian Racism shows that Canada's number of anti-Asian racism reports is higher than the US per Asian capita. The province of British Columbia has the highest in the subnational region of the continent at 44%, with Ontario coming in at 38%. Verbal abuse occurs in 65% of all incidents, which includes racial slurs, threats, and derogatory remarks. 30% of these incidents are assault, which includes targeted coughing, spitting, and physical attacks and violence. It also shows that Asian women are the most impacted, having reported 60% of all incidents. The Toronto District School Board, in partnership with the Elementary Teachers Federation of Ontario, released a resource to empower educators to stand up against anti-Asian racism at school. The City of Toronto lists ways that Torontonians can fight against anti-East Asian racism. Learn about East Asian diversity and unique identities. Abandon the myths of perpetual foreigner and model minority in thinking and language. Explore, celebrate, share, and accept East Asian stories in Canada. Know that racism hurts the collective efforts of East Asian communities to build a thriving and prosperous Toronto and Canada. And call out and challenge racism when you see it. In Toronto, Ashley Sakmar, Eagle News. We live in interesting times.
The state of Maryland has expanded eligibility for the COVID vaccine. EBC's Arlene Ocampo is standing by in Fort Washington with the details. Thanks for joining us this evening, Arlene. How are things there?
Hi, Thomas. Thank you. Based on the state's aggressive vaccination rate and an expected increase in supply from the federal government, the state of Maryland will enter phase 2 of its vaccine distribution this week. The schedule is as follows. Phase 2A starts tomorrow. Marylanders who are 60 and older can pre-register for the mass vaccination sites at covidvax.maryland.gov or can call at 1-855-MD-GOVAX. Phase 2B will start next week on the 30th to all Marylanders who are 16 and older with underlying conditions. Phase 2C will go into effect on Tuesday, April 13th. This will include those who are 55 and over, essential workers in critical industries, including financial services, ITs, utilities, and construction workers, along with those in food services. And phase 3 will begin on Tuesday, April 27th. This is for Marylanders 16 years old and above. Those who are eligible in phase 1 and have yet to be vaccinated will continue to be prioritized at the mass vaccination sites. These vaccines are not only available at the mass vaccination sites, but also at retail pharmacies, hospitals, and state-run vaccine sites across the state that receive vaccine doses from Maryland Department of Health. There are additional resources in making that appointment for the vaccine. Governor Hogan mentioned that the state is launching a pilot program to begin providing vaccine doses directly to primary care practices and mobile vaccine clinics to administer doses in hard-to-reach rural areas of the state. Governor Hogan said, and I quote, "We continue to leverage every possible resource we can to get shots into arms as efficiently and equitably as possible. We have built the infrastructure capacity, and we are being promised the supply to be able to vaccinate every Marylander in the next couple months. I can assure you that our entire team will not rest until every single Marylander who wants a vaccine has received a vaccine." In Fort Washington, Maryland, Arlene Ocampo, Eagle News. We live in interesting times. Back to you, Thomas.
Arlene, what's happening this week in Annapolis?
Yeah, here in Maryland, in Annapolis, this past weekend on Saturday marked the start of Restaurant Week in Annapolis, Maryland. This will actually go on until Sunday the 28th. And, you know, with the restrictions being lifted in the majority of the jurisdictions here in Maryland, the restaurant owners can actually safely reopen. And with Restaurant Week, participating restaurants in Annapolis are actually offering like special menus and deals throughout the whole week. So let's continue to support our small businesses here in Maryland. Thomas?
Well, with the restrictions being eased, are you going to be dining out during Restaurant Week?
Yes, actually, my family and I, we like to venture out to different restaurants, and even more so if it is a local restaurant. We definitely support the local businesses. And there is one that I do want to try out. It is a seafood restaurant there. It's called Middleton Tavern. Thomas?
What's your favorite item on the menu there?
Well, I like anything seafood. So like shrimp, scallop, lobsters, fish, the whole deal. I'm not picky.
Okay, Arlene, I'm a big seafood fan too. I see food. I eat it. Thanks for joining us tonight, Arlene.
Thanks,
Well, this will be good news for residents of long-term care centers in New Jersey, as well as their families. In-person visits will now be allowed. Mayan Manzano-Gerzan joins us live with the details. Mayan?
Thank you, Thomas. Some, if not most, of the residents are suffering from impact of social isolation for being apart from their families for so long. The Department of Health of New Jersey, in line with the guidelines released by the Federal Center for Medicare Services and CDC, released an executive directive related to visitation in long-term care centers. Take a look.
With increasing numbers of long-term care residents vaccinated and outbreaks declining in these facilities, the department is revising its long-term care visitation guidance in line with CMS and CDC. As the governor stated, New Jersey is adopting the new federal visitation guidance, which allows for responsible indoor visitation at all times and for all residents, except for a few circumstances where visitation should be limited due to a high risk of COVID-19 transmission. Long-term care facilities in regions with low or moderate COVID-19 activity level index, CALI scores, should be allowing for in-person visits for residents regardless of vaccination status. In regions where the CALI score is high or very high, and less than 70% of the facility residents have been vaccinated, only those residents who have been fully vaccinated should be receiving visitors indoors. Indoor visitation should be limited to residents with confirmed COVID-19 infection, whether vaccinated or unvaccinated, until they have met the criteria to discontinue precautions. Indoor visitation should be limited for residents also that are under quarantine, whether vaccinated or unvaccinated, until they have met criteria for release from quarantine. In the case of an outbreak at a facility, indoor visitation is still possible as long as the COVID-19 transmission is contained to a single area of the facility. Fully vaccinated residents can choose to have close contact, including touching and hugs, with a visitor as long as the resident and visitor are wearing tight, well-fitted face masks. As we have shared before, compassionate care, essential caregiver, end-of-life visitation, and outdoor visitation can be permitted even when indoor visitation is otherwise restricted because of the facility's status. The department continues to work to balance expanding visitation while working to safeguard these vulnerable residents.
For New Jersey's latest COVID-19 numbers, the Department of Health has reported another 2,608 new positive cases today, bringing our statewide total to 767,583. Sadly, we are also reporting 28 new confirmed deaths, pushing the total to 21,666 fatality. On the brighter side, the latest total of COVID-19 vaccinations already administered here in New Jersey is now 3,510,311. And for a quick weather update, Thomas, it's currently 10:11 in the evening here in New Jersey, and it's currently clear. It is now 46 degrees Fahrenheit or 8 degrees Celsius. In Sicklerville, New Jersey, May and Manzano Garzon, Eagle News, we live in interesting times. Back to you, Thomas.
And that's certainly got to be a relief for, like I say, people in long-term care residents, their families and so on, that finally you can visit mom and dad in person instead of, I guess they were doing it by Zoom. If that was even available. But aside from the in-person visits, is there going to be any further easing of the restrictions?
Well, Thomas, according to Governor Murphy of New Jersey, the state is back to leading the nation in the spread of this virus, unfortunately. So given that, Tom, he said in an interview that the state likely won't take any more steps to loosen safety restrictions for some time now because of the recent spike. So hopefully this spike that we're seeing all over the nation, Thomas, will not be that, stay here for so long that we will be obliged to go back to the square one. So hopefully not, Thomas.
You know, a month or so ago, we thought we had this all under control. The vaccines were rolling out. What's causing this? Why the recent spike?
Thomas, officials here in New Jersey haven't answered that specifically, or what is driving the rise in the case here, though they have warned about the spread of more contagious variants of COVID-19, as we are all hearing from different parts of the world. The state has identified more than 400 cases of variants of concern, including 389 cases of the variant first identified in the UK. Here in New Jersey, 7 cases of 2 California variants, 3 of the Brazil variant, and 1 South African variant. There's also 65 cases of New York variant here, Thomas, which is considered of interest by the Federal Centers for Disease Control. Thomas?
That's pretty much the same as up here in Canada. Variants are causing a lot of concern in public health departments, and I know today in Alberta we were slated to ease some restrictions. No, they put the brakes on that idea. No restrictions will be eased for the time being, because although our hospital numbers are somewhat down, they're set to go up because, again, we're having a spike in new cases. They're being caused by the variants. These things spread like wildfire through a population, and within 2 weeks after you report the new cases, the hospital numbers start to grow up. So we sympathize with you down there in New Jersey, Mayanne. Thanks for joining us this evening, and stay safe.
You too, Thomas. Thank you.
Still to come, we've got stories from Texas and Washington, D.C., as well as California. This is Eagle News America.
Events happen around us all the time, in our community, in our country, around the world. Events that affect people, move communities, or simply inspire us. Interesting events that people need to know. In these interesting times, we continue to be a competent partner in delivering news about these events. Fast, accurate, balanced. Eagle News, because we live in interesting times.
Our March monthly winner ay walang iba, kundi si...
You captured my heart.
Wow, iba ka, iba ka.
Pag kumakanta siya, nakangiti lagi. Para bang ikaw
Nakabang ang lahat, kaya pilitin mong ikasan na di marami. May pangyayang matakalas.
This is Southeastern Australia Part 2 Singing Edition.
You're watching Eagle News America. I'm Thomas I. Likeness. Well, a Texas congressman has released pictures of the conditions inside a holding facility in the community of Donna, Texas. That story, as well as comments from the governor, from Eagle News correspondent Jane Kathleen Gregorio. She joins us live. Good evening, Jane. Thanks for being on the program.
Good evening, Thomas, and howdy from the Lone Star State. Our news brings us to Donna, Texas, where migrants that have crossed the border are being sheltered temporarily. On Monday, the office of Democratic Texas Congressman Henry Cuellar released photos showing the crowded conditions of the migrants inside of a U.S. Customs and Border Protection temporary overflow facility in Donna, which is located near the southernmost tip of Texas, near the Mexican border. This Customs and Border Protection facility opened on February to handle the growing number of migrant border crossings, which includes thousands of children. As the White House is limiting media access to the border facilities to minimize the spread of COVID-19, these exclusive photos from the congressman offer a rare glimpse of the inside. The congressman provided the photos to raise awareness of the situation. He told Axios that the migrants are being kept in 8 pods of the so-called soft-sided facility and can fit 260 persons each. But as of Sunday, he mentioned one pod held over 400 unaccompanied male minors. As we can see from the photos, the migrants appear to be using plastic sleeping pads on the floor with aluminum foil blankets, with about a dozen sharing individual pens, and most are shown to be wearing masks. Congressman Cuellar stated that he had recently visited a shelter for children, but did not tour the facility himself in Donna, nor take the photos himself. These are photos that were taken over the weekend. He described the setting as terrible conditions for the children and said they need to be moved as soon as possible under the care of the Department of Health and Human Services. He mentioned that Border Patrol agents are doing the best they can under the circumstances, but are not equipped to care for kids and need help from the administration. On Sunday, Homeland Security Secretary Alejandro Mayorkas stated that the administration was working to speed up processing. Meanwhile, Thomas, as you mentioned the issue of potable water earlier, that is also an issue affecting one of the migrant holding facilities in Texas. After the Biden administration announced that a 4th holding facility for unaccompanied minors will be opened in Pecos, Texas, Governor Greg Abbott issued a statement Saturday that the Texas Commission on Environmental Quality will be ensuring that the potable water at the facility is safe for consumption, as a recent investigation revealed that the water at another migrant facility in Midland, Texas was deemed unusable. Governor Abbott stated that the Biden administration continues to show that it is dangerously unprepared to handle the surge in illegal border crossings as they rush to open yet another facility for unaccompanied minors in Texas. He posed questions to the administration asking if the federal government is tracking what countries these children are coming from, what COVID-19 variants could they have been exposed to, and how long will these children be held in Texas. On March 6th, the governor implemented Operation Lone Star to send resources to high-threat areas on the border. On Wednesday, he announced that the operation will now include anti-human trafficking efforts. Hope you're staying safe and healthy in your part of the country. In Corpus Christi, Texas, I'm Jane Kathleen Gregorio, Eagle News. We live in interesting times. Back to you, Thomas.
Jane Kathleen, your governor recently removed the mask mandate down there. How are people reacting to that? Are they overjoyed? Are they saying he moved too soon? What's been the reaction on the street?
Well, the reaction on the street is pretty mixed. But what I can tell you, Thomas, is that although he removed the mask mandate and increased the occupancy to 100%, people are still taking precaution. He did mention that the removal of the mask mandate doesn't necessarily mean that everyone is required to remove their mask. No, actually, he gave the freedom to businesses and local government facilities to be the ones to decide their own destiny. And what I'm observing, every place that I go, restaurants, stores, everybody is still implementing the mask mandate on their own. Thomas?
How are your positivity rates there as of right now? I know up here we've got an increasing number of cases, especially cases caused by variants. What's it like down there in Texas?
Well, Thomas, actually, it's good. It's good that you mentioned that, because today, just a few hours ago, Governor Abbott announced on his social media that the 7-day COVID positivity rate has dropped even lower today to 5.76%, and that is just 0.02% away from a one-year record low. He mentioned that the positivity rate has been below 7% for over 2 weeks. Right now, we have over 61% of seniors, 36% of Texans ages 50 to 64, and 255,000 educators that have already received the COVID vaccinations. Thomas?
Well, it's good to see that the vaccine rollout is going well there. Incidentally, have you got the vaccine yet?
Yes, Thomas, I actually received the vaccine.
What was it like? Because I'm waiting for mine. My appointment's in 2 weeks. Things just move a little slower up here, you know. But I want to know what I'm in for. What's it like?
Well, when I took my vaccine, I was actually just driving my elderly parents to get the vaccine. They were being done at a mega vaccine facility, which was done at a large park in Kingsville, Texas. And when I went there were over 1,000 cars lined up. But the traffic went by pretty fast, because what they did is they actually just went up to you in your vehicle, and you had to register, of course, in advance. And the vaccine was actually it didn't hurt at all. It was very, very fast. I wasn't really scheduled to get the vaccine, but they told me since they had a lot of extras and they didn't want it to go to waste, they offered me the chance to have it. So far it was actually a very pleasant experience, and I'm waiting to get my second dose this April 1st. Thomas?
April 1st is when I'll get my first dose, and then I'll have to wait about 3 to 4 months. Like I said, we move slower up here. 3 to 4 months for the second. Thanks for joining us this evening, Kathleen. Stick around, and we'll talk more about water near the end of the program. In Washington, D.C., nearly $3 million is up for grabs for community organizations that offer summer programs to young people. EBC's Eliza Gonzalez-Manglicmat joins me now. Eliza, what sort of programs are we talking about here?
There's a lot of programs, Tom. Good Monday evening to you, and a good Tuesday morning to our friends on the other side of the globe. Now, kids always look forward to summer, and in Washington, D.C., the youth have 2 million more reasons why they should this year. And that's because D.C. Mayor Muriel Bowser awarded $2.92 million to 38 community organizations in the district to be used for summer youth programs. The funding will support more than 2,200 young people here in the nation's capital, and the money will be used in summer programs dealing with academics, arts, athletics, dance, cooking, financial literacy, mentoring, music, social, emotional support, STEM, and so much more. And because we're not out of the woods yet when it comes to the COVID-19 pandemic, safety and health protocols for in-person programming will be followed in these summer activities. Now, after everything that kids have gone through recently, Mayor Bowser says kids deserve this. She said after a challenging year, it's more important than ever that this summer we offer our youth a chance to learn new skills, explore opportunities, and have fun with their peers in safe and healthy environments. In recent years, the Office of the Deputy Mayor for Education and the Office of Out-of-School Time Grants and Youth Outcomes have worked to improve the quality of out-of-school time programs. Now, some of the 38 organizations slated to receive funding this summer are Arts of Our Children Incorporated, Dance Institute of Washington, DC Strings Workshop, Mentors of Minorities in Education, Tutoring Cafe, and Tech Turnup. The mayor's office encourages DC residents to support after-school and summer programs by making a contribution to taxpayers' support for after-school programs for at-risk students on their individual income tax form. Now, the funds support grants that open opportunities to district youth beyond the normal school day. District residents can locate OST programs and resources for youth and youth-serving organizations throughout the district at learn24.dc.gov. Now, for some weather update, it is now 62 degrees Fahrenheit or 17 degrees Celsius here in the nation's capital. In Washington, Eliza Gonzalez, Manglik Mott, Eagle News. We live in interesting times. Back to you, Thomas.
Eliza, these programs sound like a great idea for the kids in the summer, but you know, with the threat of a possible outbreak because of COVID variants, I think it's a good idea that the kids get out there this summer.
I know that's a concern, Thomas, but most definitely, like what Eagle News has brought up multiple times, one of the consequences of this pandemic that we are all in is the toll it's been taking on the mental health of people, especially the youth. You know, childhood, it's that stage in life where a person just goes out and explores, and there's no better season than summer to do that. But given that there is still a threat when it comes to COVID and now the looming threat of variants, that's all the more reason to give kids a place where they could expend their energy in a positive and safe way. That's why in the programs that the district is funding, it was emphasized that COVID safety protocols will certainly be followed. Thomas?
You mentioned a lot of summer programs that this grant would fund. I'm curious, as a kid, think back, what was your favorite summertime activity?
Okay. Well, first of all, Thomas, my summertime activities when I was a kid, it didn't need 2.9 million in funding. All I needed was a bike, a tree, and some insects. Well, with that, to answer your question, Thomas, some of my favorite things to do in the summer when I was a kid were to ride bikes, climb trees, and catch dragonflies and spiders. But they're probably very common things to do for kids, whatever part of the world they live in. But you know, Thomas, the times now are a lot different from many, many years ago, and the needs of the youth when it comes to development, social interaction, and personal growth, they have evolved in more ways than one, correct?
Some of it good, some of it bad. I mean, couldn't you lose the phone for a little bit? Just asking. Just asking.
I agree.
Thanks for joining us, Eliza. Up next, you've heard the old saying, a spoonful of sugar helps the medicine go down. Well, EBC's Julianne Simbulan will tell us how that works at a California vaccine center. And of course, we've got our roundtable coming up tonight, the need to conserve water. You're watching Eagle News America.
innovation, digital disruption, globalization. Startups, micro, small, and medium enterprises, as well as large corporations, all face interesting challenges in the market today. Peek into the world of exciting opportunities and partnerships to drive growth with the latest business news and information. We are open for business. Your weekly dose of entrepreneurial inspiration to update you on the latest developments in the world of business. Get up close and personal with CEOs and thought leaders to help you discover valuable insights, sharpen your instincts for smart decision making with the latest markets and economic trends, disruptive ideas, global innovation, social entrepreneurship, and other leading-edge business ideas. Join the conversations to create a more vibrant environment for entrepreneurship. Catch Open for Business, from vision to action.
Start up your weekday mornings with edutainment, news, and information kasama ang inyong paboritong Net25 shows. Samahan ang inyong paboritong morning barkada sa Pambansang Almusal at 5 a.m. Tatalakayin mga pangunahing balita sa pagtutulungan ng Radyo Agila at Net25. Samahan si Weng de la Fuente sa Balitalakayan, 7 a.m. Saganang Mamamayan at 8 a.m. NHK World at 9 a.m. Eagle News International at 10 a.m. At mga balitang dapat niyong malaman mula sa Agila, Pilipinas at 11 a.m. This is your morning startup every weekday mornings only here on Net25.
Take one step further and face the impossible. Time to search the unknown and fight for the truth. Time to overcome boundaries and connect the world. It's time for DW News.
This is Eagle News America. I'm Thomas I. Likeness. Well, you know, if I were at all hesitant about getting the COVID vaccine, I think this would sway me. EBC's Julianne Simbulan tells us about a California vaccination site that offers free donuts to people who get immunized. Thanks for joining us this evening, Julianne. What's this all about?
Thank you, Thomas. So, in an effort to support vaccination efforts throughout Southern California, various businesses are implementing incentives to those who have received their COVID-19 vaccine. Incentives like these are not something new to those living in Los Angeles County. During the rapid surges in hospitalization due to coronavirus seen throughout Southern California more than 2 months ago, many businesses and franchises provided incentives then to healthcare workers and frontliners to show their appreciation for all their selfless acts in keeping the communities safe during the pandemic. And now, with the drastic decreases in COVID-19 cases and in an effort to safely reopen Los Angeles County, many businesses such as Krispy Kreme are joining in on rewarding those who have received their COVID-19 vaccine. by giving them a free donut. This promotion will last until the end of the year. The Krispy Kreme franchise announces on their website, quote, Krispy Kreme is funding COVID-19 vaccinations to show our support for those who choose to get vaccinated starting today, March 22nd. Anyone who shows their COVID-19 vaccination record card will receive a free original glazed donut, end quote. Those who are eligible to receive this incentive are individuals who have been administered at least the first dose of the Moderna or Pfizer vaccine or the one dose of the Johnson & Johnson vaccine. Angelinos interested in redeeming this promotion just need to show their vaccination card to any participating Krispy Kreme location to receive their free donut. In Lancaster, California, Julianne Sambulan, Eagle News. We live in interesting times. Back to you, Thomas.
Julianne, can you redeem also for your family members and friends by showing their vaccination cards?
So that's a good question, but unfortunately, Thomas, Los Angeles residents will not be able to redeem this promotion for their family members and friends, even if they have multiple vaccination cards. This incentive is limited to one free donut per day for that individual customer, so you will need to show up with your own COVID-19 vaccination card to take advantage of this offer. Thomas?
Okay, so what if somebody misplaces their card? Can they show their sticker instead? You know, the sticker you get after you're vaccinated, stating that you've been immunized for COVID-19. Will that work?
Actually, Thomas, this also will not be accepted. Krispy Kreme is strict on this proof of COVID-19 vaccination, so it really needs to be the actual COVID-19 vaccination card. Thomas?
You know, I just can't get a free donut out of this. It's a sweet treat for those who are qualified and who have opted to be vaccinated. Does this mean that there are no promotions for those who have decided not to be vaccinated?
That's a good thing that you mentioned that, actually, Thomas, because the company is also very understanding that it is a personal choice to be vaccinated for COVID-19. So they have also announced an upcoming promotion starting March 29th until May 24th that customers who visit on Mondays are eligible to receive a free original glazed donut with a medium brewed coffee to start the week on a happy note. Thomas.
Sounds good. And you know that donuts are health food? And I know this is true because every time I eat one, I feel great. So let's all gather around the round table now. And tonight's topic is a little more serious. A little more serious than we usually talk about. Is World Water Day. And as we told you at the beginning of the program and was alluded to in our report from Texas from Jane Kathleen, there is a global shortage of potable water that is drinkable, that is usable by people, that's clean. And we want to talk about that tonight and weigh in on that. We've heard that worldwide there's 450 million children don't have access to clean water to meet their needs. So we're going to go around the round table here. We take it all for granted. I mean, you want water, you just go to the tap and you turn it on and you got water. And if you want to drink it, you can drink it. You don't have to worry about parasites in it or getting an infection or anything. You get thirsty while you're out and about, you stop in at a convenience store, you buy a bottle of water. Here, I think we just take it for granted. And what I want to find out is what you all do to conserve water, because it is a very precious resource and we could run out one day. We'll start with you, Jane Kathleen. You brought us that story that there is a shortage of good drinking water in these holding facilities in Texas for immigrants.
That's right, Thomas. And also with regards to the shortage of water, we experienced that recently when we had the winter ice storms, and it affected our electricity as well as our water because of the pipe burst. So during that time, I experienced really having to conserve water. We had to fill. One of the things we did was we took all the, people always, get water bottles and, they forget that it belongs to them. And there's all these half drank water bottles laying around. So we started boiling those to be used for cooking or even making coffee.
I'll bet you, Jane Kathleen, when that happened, all of a sudden you no longer took water for granted.
That's right, Thomas. We really were cautious on how we use water. Even the smallest amount can be used for something like, just washing hands or, cooking or whatever. And you just appreciate it so much more after it being taken away from you. I totally agree, Thomas.
What about you, Mayanne?
Well, Thomas, you said it yourself. It's unfortunate that we take our clean water for granted, given that we have billions of children from other parts of the world who have no access to it. So my simple ways, and I owe this to a documentary I watched on Netflix a couple of years ago. My simple ways are to always turn off your water while brushing your teeth, because before I would just be very unconscious of it and just let it run while brushing my teeth and while washing the dishes. So Tom, thanks for this reminder as well that sometimes I'm not perfect, I still forget, but thank you for this episode and all these information that we get to be reminded to conserve our water. Thomas?
Julianne, how do you conserve water?
Yes, I completely agree with what everybody has said. It's easy to, take water for granted because, we live in a country that is very rich in these resources. So, we just go to the bathroom and maybe go to the kitchen downstairs and we have access to that. But for myself, the main thing I really think about is taking, showers, shorter showers. Of course, hygiene is important, and it's important to remember, the ample time you need to, fulfill that good hygiene. But the thing I also think about is that you don't always have to have the shower running, while you're washing your hair, you're washing your body. So you don't really have to keep it on all the time. You could turn it on and turn it off. It's kind of just like brushing your teeth, you turn off the water when you're actually brushing your teeth. You don't leave it on. So it's a little bit similar to that. And, people could take showers in that manner.
We're hearing some good ideas here. Eliza, what about you?
Before I share my ideas, I'd like to share with you that the report you said earlier about millions of children in Nigeria without access to clean water, it really hit home for me. I remember how scarce water was when I was a kid. We had to pump water to have something to drink. We covered the pump spout with cloth to make sure that the water coming out of it is clean. We pump water to bathe with, to wash dishes and clothes with. And sometimes when it rains, we're so happy because that means we don't need to pump that day. We put buckets under roof gutters so we can fill them with rainwater to use for bathing, cleaning, and washing the dishes. So I grew up knowing that water shouldn't be wasted. So hearing all these ideas how to conserve water, let me, if I may add, we could use leftover water, what Kathleen said, or half-used bottled water to water plants. Or when in restaurants, let's ask for water only if you will actually drink it. Because sometimes, they just automatically give you a glass of water, but you don't really drink it. So, yeah.
We'll let you wrap up this discussion, Arlene.
Yes, all the ideas from the ladies pretty much the same with me. But there is one way of conserving water also, if you were to clean up your driveway, instead of just letting that hose run to clean it up, pick up a broom and just, clean up that driveway that way instead of just letting the hose run. Another thing too, in the summertime with the kids, the younger kids, they have the sprinkler out in the backyard. They just let that run all day long. So maybe not do that too long, not too often, but yeah. And yeah, pretty much also the same thing I do also with the water bottles is just the rest of them, pour them in the plants and, feed them to the plants.
Yep, my wife does that. Water she washes the vegetable in goes into a bowl, which ultimately goes into the house plants. The other thing is, if you got a dishwasher, use that instead of the sink, because it actually uses way less water than washing your dishes in the sink. And just think, saves your hands. Saves your hands. I want to thank you all for joining me tonight for this discussion. But before we go, let's recognize our people on the front lines, the sacrifices they've made to see us through the pandemic. Let's give them a round of applause and appreciation tonight. And that's tonight's Eagle News America. Thank you for joining us. I'm Thomas I. Likeness, and truly, we live in interesting times.